As cases and hospitalizations remain high in our state, emergency rooms are beginning to feel the burden. THV 11's Mercedes McKay joining us live now. Mercedes, what problems are they running into during this new surge?
Marlisa, emergency departments like the one here at UAMS began to experience those higher than normal volumes a couple of weeks ago. One doctor tells me what they are seeing right now in their ER is scarily similar to last summer's surge.
I'm hopeful every day that we've reached our peak, and then it turns out to not be the case.
While hospitals get crowded again as the Omicron variant spreads across Arkansas, emergency departments are now dealing with a similar issue.
We're experiencing higher than normal volumes. We've seen a large uptick in daily volumes to include our weekends throughout the night.
UAMS's Chief Clinical Officer, Dr. Ross Paul, says COVID patients and people who have delayed certain care are filling up emergency rooms.
About a third of our patients who end up being diagnosed with COVID arrive at our emergency department for other reasons that are completely unrelated to COVID.
The trends are similar at CHI St. Vincent and Little Rock, but Chief Medical Officer Dr. Jerry Jones says there's another factor causing the current rush.
A large number of people who are concerned about having been exposed and who are asking for testing.
Dr. Jones says people coming to the ER for COVID testing creates a burden in two different ways.
Number one, it's additional people that need to be seen, that take up time and resources. And number two, it's using up more and more tests.
To help reduce this load, Public Affairs Officer Chris Durney says the VA hospital in Little Rock has a park and swab set up right outside their emergency department.
That's something that we did very early on because we know that we want to keep our facilities clear for people who have both COVID and other issues and need to be taken care of.
While no one knows when this will end, hospital officials say the best thing we can do right now is protect one another.
Let's all do all we can to get over this surge very quickly. Wear your mask, get vaccinated, get boosted, get this behind us.
And just to put in perspective how much more volume these hospital emergency departments are experiencing right now, the VA here in Little Rock usually sees about 450 to 500 people a week. Now that number is up to 900. Live in Little Rock, Mercedes McKay, THV 11 News.